I want to welcome all of our business partners and all of our guests this evening. I'm Dr. Rita McGuire, the Chief Medical Officer here at Wakana and one of the co-founders, and I'm excited to present this evening some information about one of the leading neurodegenerative conditions that affects hundreds and thousands of Americans, and that's Parkinson's disease. So the first part, we'll talk about Parkinson's disease, what it is, some of the risk factors, as well as some of the symptoms. And then we'll move into how CBD, cannabidiol, can assist with many of the symptoms that those who have Parkinson's disease can benefit from. So I'm going to share my slides now. And just to start off, we're going to talk about some of the stats as it relates to Parkinson's disease. And according to the Parkinson's Foundation, I didn't realize that nearly 60,000 people are diagnosed with Parkinson's disease every year. And about 500,000 people are living with this disease in the US. It's also the 14th major cause of death in the US. Research is still ongoing to date to find a cure or a way to prevent this disease. And that's why this Zoom is so important this evening, because CBD has been shown in a lot of research that I'll share with you this evening to help to reduce some of the symptoms that those who have Parkinson's disease have. So we all know Michael J. Fox. He's well known for starring in our old favorites like Back to the Future and Teen Wolf. And he's also become very well known for being an advocate of medical marijuana as well as CBD oil to treat Parkinson's disease. See, Michael J. Fox was first diagnosed with the young onset of Parkinson's disease in 1991. He was only 29 years old. He kept this diagnosis as a secret for about 7 years, and then he went public in 1998. So he has advocated and raised a lot of money as it relates to research with those who are living with Parkinson's disease. So what is Parkinson's disease? Well, I try to break it down really, really simply. Parkinson's disease is a progressive neurodegenerative disease that occurs when the brain that makes dopamine can no longer make it. When your brain is unable to make dopamine, that's a chemical that coordinates movement, it causes tremors, and that is characteristic of those with Parkinson's. You'll see their hands shaking. It causes slowness. They usually have a shuffle. Their gait is a shuffle. They have a lot of stiffness. They have balance issues, and many have mental health problems. In some cases, it can also lead to depression and memory issues. And again, right now, there's not a definitive cure for this very debilitating disease. So what happens? Well, there is a small part in the brain called the substantia nigra. And Parkinson's disease, again, is primarily associated with the gradual loss of cells in the substantia nigra of the brain. And the substantia nigra is an area that's responsible for the production of dopamine. Now, dopamine, as we said, is a neurotransmitter, and it transmits signals between two regions of the brain to coordinate activity. It's typically motor activity. So this pathway here that you see is responsible for dopamine connecting and transmitting and communicating with the striatum. And when that dopamine is in deficit, it causes the symptoms that we see in those who have Parkinson's. That's being tremors. That deficiency causes the nerve cells in that striatum to fire out of control. So these folks are unable to really control their movement. When they're tremoring, they can't control it. So it's a progressive disease. It's a neurodegenerative disease that affects the brain and the central nervous system. And as it progresses, it causes more and more severe symptoms. So initially, a person may see a little tremor, a little shake in the hand, and it gets worse and worse as that area in the brain is not able to produce that dopamine. So what are some of the risk factors for Parkinson's disease? Well, men are more likely to get Parkinson's than women. Whites are more likely to get Parkinson's than African Americans or Asians. And then there's certain toxins. Exposures to certain toxins can also increase the risk of getting Parkinson's. There's some genetic predisposition. So there's a family history many times of having Parkinson's. And people who come under the age of 50 and 60 are at risk of getting Parkinson's. Also, people who've experienced severe head injuries are also at risk of getting Parkinson's. So yes, there's a genetic component, there's aging, there's gender, and then there's also some comorbidities and life events that can increase the risk of Parkinson's. Comorbidities like cerebral vascular disease, having had a stroke, type 2 diabetes, hypertension, hypercholesterolemia, environmental exposures. We'll talk about some of those environmental exposures, and social disengagement. And then my favorite, lifestyle and mental health. People ask me all the time why I don't drink alcohol anymore. Well, alcohol is toxic to our brains, right? That's another lifestyle modification that you can alter to reduce your risk of Parkinson's. Your diet high in fatty foods, high in inflammatory foods, animal protein. One of the another reasons why I changed and have now become a vegan. There's some mental history, like personality traits, education, depression, sleep disturbance. When I look at my colleagues who are now 70, 80, many of them have Parkinson's. They develop Parkinson's in their late 50s and early 60s. Why? Because sleep deprivation is a part of our norm, right? Being a physician, we get very little sleep. And so all of these things, knowing, can be preventative so that Parkinson's disease or our risk factor for Parkinson's disease is not high. So gene mutation, certain exposures to toxins, the low level of dopamine, some presence of abnormal proteins in the central nervous system and the brain are all causes of Parkinson's. Well, let's look at the genetic factors. There are certain genes that they have found in research that may be associated with Parkinson's. In fact, at least 15 to 20% of Parkinson's disease patients have a close relative who has Parkinsonian symptoms. There may be more than one genetic factor in the causation of Parkinson's disease, but when we look at genetic factors combined with environmental factors, that also can be an increased risk. Toxins, we see toxins everywhere, right? That's why many of us on the line have really adopted a vegan or vegetarian lifestyle, a lifestyle where we're eating more fruits and vegetables that are organic. Why? Because many of our foods are full of toxins. They're full of toxins from the pesticides, from the plants, to pollution, to manganese dust and carbon monoxide poisoning. All of these insecticides, all of these toxins are all around us. And that's why you want to reduce your risk by eating as many organic fruits and vegetables as possible. Being aware of what you're putting on your skin, right? Deodorants, toothpaste, all of these things can be absorbed into your system. So In 2009, I thought this was interesting that the U.S. Department of Veterans Affairs added Parkinson's to a list of diseases that possibly are associated with exposure to Agent Orange. When we look at the natural aging process, as we age, we know that there are some neuroinflammatory cells in our brain that also affect the area of dopamine production. Aging is a natural process, right? We all are going to be getting older. So that's why you really want to be very intentional about your diet. You want to be very intentional about what you're putting in your body. You want to be intentional about your sleep or lack of sleep, because as we age, there are certain changes that we see in our brain, but we can reduce those changes in the brain. We can reduce the risk of Parkinson's by lifestyle modification. Another thing you'll see on the slide is mitochondrial dysfunction. Now, I didn't add the product mitotrol that we just released here at Wakana, but mitotrol actually is a polypeptide, a polysaccharide peptide that actually helps to feed those cells, our energy cells that produce ATP from aging as well. So the aging process, the genetic factors or predisposition, toxins, all of these things can predispose us to Parkinson's disease. So what do we treat Parkinson patients in medicine? Well, we have many drugs that increase the dopamine level. They're called levodopa drugs, right? RITA is another brand name prescription medication. It's FDA approved. But the problem with many of these medications that we use on our Parkinson's patients is the side effects. The side effects are not very good, increased risk of severe depression, suicidal ideation, also causing a lot of havoc on internal organs like our kidneys and liver. So this is a great conversation that you can have with those that you love or family members that you know that have someone with Parkinson's, that there's an alternative. There's more of a natural, holistic alternative. And that's why Michael J. Fox is such an advocate for using cannabis for symptoms that can be reduced with cannabis and the plant. So let's move on to cannabis or cannabidiol. CBD is an abbreviation for cannabidiol. Now, the CBD that we're going to be talking about tonight is the CBD that's sourced from the part of the cannabis plant that doesn't give you a high, and that's called hemp. That is a species that has high levels of CBD and very low levels of THC. Now, THC is the part of the plant or the compound that's in the plant, the cannabis sativa plant, that gives you the high, the euphoria, the paranoia. But none of our products here at Wakana give you the high, the euphoria, the paranoia, or even the munchies. CBD is non-mind altering. No high, no seeing deer in your driveway. And that's why so many folks are utilizing CBD, especially when you have family members that want to reduce the risk of their loved ones who have Parkinson's, because they can do this safely and effectively without giving a high. So what are we looking at? Well, we're looking at CBD helping to assist with the movement abnormalities, the tremors, the painful joints, the insomnia, improving mood, anxiety, irritability, all of these symptoms that we spoke about, that those who have Parkinson's, we can help reduce some of those symptoms. We can't cure Parkinson's with CBD, but we can actually help to ease some of the symptoms that they have. So when we look at many of the medicinal benefits of CBD, One is that CBD is neuroprotective. So it can help to reduce the inflammation in the glial cells, as well as to help release more dopamine in the central nervous system. So CBD does help to reduce those neurodegenerative conditions or symptoms that neurodegenerative conditions have. It also helps to reduce inflammation. CBD helps to relieve pain. It helps to relieve anxiety. There are over 20,000 peer-reviewed articles that not only talk about CBD and its benefits to the body, but I'm going to share with you some articles that specifically talk about CBD and Parkinson's disease. Now, what's of other what I want to point out of concern that you should know, or something you should know, not a concern, but some information that you should know, are other cannabinoids that the plant makes. Not just CBD, but when you synergistically utilize some of the products we're going to talk about tonight, a full product CBD, like these other cannabinoids synergistically on a cellular level really give you optimal relief of symptoms that you're trying to address. Those other cannabinoids are listed here, like CBG and CBC and Delta 8 THC and Delta 9 THC and CBCA. All of these other cannabinoids also help to reduce pain. It also helps to suppress muscle spasms and the movement dysfunction that Parkinson's has. It helps to reduce pain and inflammation, as well as improving sleep. So that is something that you should know, that there are other cannabinoids of interest that help to benefit those who are looking to use our CBD product. Now, is CBD legal? Yes. In 2018, the Farm Bill was passed. It's an agricultural bill, but this bill removed hemp from being a Substance 1 drug. So for decades, hemp, which is the legal species of the cannabis plant in all 50 states, was finally removed from being a Schedule 1 drug. Now, a Schedule 1 drug is a very dangerous drug. It's your drugs like cocaine and LSD and all of these very dangerous drugs that have safety concerns. These are drugs that have high potential for addiction, but CBD sourced from the hemp plant, as long as it contains the legal limit of THC, which is 0.3% or less, was deemed legal to cultivate, to sell, and consume in all 50 states. So yes, these products are legal. So how do these products work in the body? You know, we talked about Parkinson's. We talked about what is happening in Parkinson's. And there's a part in the brain, the substantia nigra, that is important for producing the dopamine, and the dopamine to connect to the striatum of the brain so that there are no issues with movement and coordination. Well, CBD, cannabis, works in the body through this science. It's called the human endocannabinoid system. And we all have an endocannabinoid system. And this system is made up of receptors like CB1 and CB2. These receptors are found in major organs and glands in our body. These receptors are found in our brain, in our central nervous system, in our heart, our lungs, our liver, our kidney, our teeth, our skin, our pancreas, our reproductive tract. You can look at the diagram right here in the middle, where all of these receptors are found from our head to our toe. So when we look at CB1 receptors, they are important in motor activity. So when one consumes CBD, it binds to those receptors in the brain, in the substantia nigra, and it helps to put the body back in balance. Now, again, CBD won't cure Parkinson's disease, but because of the endocannabinoid system, when you consume CBD, it helps to reduce the symptoms that those who have Parkinson's disease has. So here are some pre-clinical evidence in this article that CBD, of course, we know from preclinical evidence that CBD has anti-inflammatory and antioxidative properties. And this is very important when we're talking about Parkinson's disease. Parkinson's disease, again, results in inflammatory cells, the glial cells in the brain that are now very inflamed and causes symptoms that we see in Parkinson's. Also, the antioxidative property that CBD has helps to reduce those free radicals that also are a culprit in causing chronic disease states in our body, like Parkinson's disease. This is a little chart that is probably out of order. It should have been next to that CBD wheel, but this just gives you some terms and meanings when we talk about full spectrum. Full spectrum is a product that contains all of the natural compounds in the cannabis plant, including THC. However, the THC level is no more than 0.3% or less to comply with the Food and Drug Administration and the hemp 2018 Farm Bill. So just know that there are something called broad spectrum products where the CBD is there, but the THC is less than 0.000%. So that is another formulation that's not pretty utilized by those who have Parkinson's disease, because most folks with Parkinson's disease are not working, they're not undergoing random drug screens. So a full spectrum product is something that I would recommend. Another term that I want you to pay attention to is at the bottom, and that's certificates of analysis. So this is something that we pride ourselves on here at Wakana, that the FDA doesn't require that CBD companies have certificates of analysis, but this allows you as a consumer to see that the product, the potency of the product, the fact that the product is free from mold, mildew, heavy metals, and pesticides, or heavy metals, any toxins. We don't want to give that person who has Parkinson's disease any toxic chemicals in the product. So it's a third-party validation that's done by an outside lab to ensure that what we say is in the bottle is actually in the bottle. So here's another study that talks about how CBD can be used very safely and is very tolerated well in those who have Parkinson's disease as well. Another study that shows the use of CBD and its use on the motor symptoms of those who have Parkinson's disease. They're utilizing a double-blind randomized control studies. All of these studies can be found in PubMed. This is another study that if you want studies, you can just email me. This is a clinical trial that looks at the efficacy of CBD on tremors in those who have Parkinson's disease. So let's talk about some of our products that I would highly recommend for those who want to utilize CBD to assist with their symptoms. Again, we cannot make claims that our CBD product will cure Parkinson's, but absolutely can assist with a lot of the symptoms that we talked about. This is a disclaimer, again, stating that the FDA has not approved of any of these statements, that the efficacy of these products have not been confirmed by FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information provided here are not meant as a substitute for or alternative to information from your healthcare practitioner. Please consult your healthcare professional about potential interactions or other possible complications before using any product. The Federal Food, Drug, and Cosmetic Act requires these statements. So here's an example of our certificates of analysis. Our certificates of analysis are actually one-pagers, so they're not that difficult to read. But again, it gives you the consumer, all of the information on the potency. This is one of our broad spectrum products. The potency, the fact that this product doesn't have any mold, mildew, heavy metals, or pesticides. There are no residual solvents. And this product, as we state on the label, is what's actually in the bottle. We pride ourselves with all of our products come with a certificate of analysis. And we have products by industry. We have products for weight loss here at Wakana. We have products for wellness and immune. We have products for hair care for those who are facing some excessive shedding or alopecia, hair loss. We have essential oils, we have skincare, and of course, our CBD products as well. So again, I want to emphasize again and again that our CBD products can assist with symptoms of those who have Parkinson's. Our CBD products will not cure your loved one who has Parkinson's, but the CBD products that we're going to talk about can help reduce dystonia or the repetitive muscle movements that make body parts twist in those who have Parkinson's. It can help reduce the pain and inflammation in joints. It can help that person sleep better, can address insomnia. It can help to reduce tremors. It can help reduce anxiety and other mental behavioral issues that those who have Parkinson's disease. So these are my recommendations for those who have Parkinson's and you want to help to address and reduce some of the symptoms. I want to start out with our Extreme Power Pain Cream. Our Extreme Power Pain Cream is our #1 selling topical product. It is CBD, 400 milligrams of CBD in a 1 ounce or 30 ml jar. It also is enhanced with the other cannabinoids. It's a full spectrum product. It has also enhanced with essential oils that help to enhance the properties of CBD by reducing inflammation, by reducing pain. I recommend that you utilize this product on that patient or that loved one that has Parkinson's, and you utilize it in areas where they're having joint pain, where they're having a lot of stiffness. You can utilize it on their knees, their back, their shoulders, their feet, any area that's causing a lot of discomfort. Now, I love using the Extreme Power Pain Cream at night, just rubbing their body down at night so that cream can really sink in. It can help them sleep so they're not having that extreme pain. Now, the Dr. Rita's Rub is the next product that I recommend. This is our liquid relief. Again, it's CBD, a full spectrum CBD product enhanced with essential oils that reduce inflammation and pain. The Dr. Rita's Rub is in a roller ball. I love using this during the day. Throughout the day, you can just roller ball it on that area that they're complaining they're having a lot of discomfort. I like using the cream at night, and I like using the roller ball during the day. The next product is our tincture, our Hemp MD. Now, I recommend the Hemp MD for those who have Parkinson's because it's more of our most potent tincture. Tinctures are taken underneath the tongue. You simply place it underneath the tongue and allow that to sit for about 60 seconds before they swallow. By Hemp MD being the more potent product, our tincture, and it is a full spectrum product. It's our power product. All of our products that are in a black label or have the word power on it allows you to have that legal limit of THC, 0.3% or less, and that's what I recommend. I recommend all power products for those who want to assist with symptoms of Parkinson's. So 3 drops in the morning, 3 drops in the evening is a great way to start the Hemp MD on those who have Parkinson's. What are you doing? Where you're helping to reduce those symptoms, the symptoms of irritability, those symptoms that they're having due to pain, tremors. We're not trying to cure Parkinson's, but we're trying to reduce the symptoms. Now, after 4 or 5 days, if you see that symptoms are still not reduced, you can increase the dose. You can increase that dose from 3 drops twice a day to 8 drops twice a day. In 4 or 5 days, you're not seeing any symptoms reduced, you can increase it to 15 drops twice a day. But I recommend that you start low and you start slow with 3 drops twice a day. The next product I recommend is the Power Gummies. The Power Gummies are another way of consuming CBD. You can use it topically, you can use it as a tincture, and you can use the gummies. I recommend all 4 of these products. Not 1, not 2, but all 4. Because as the topical is working, that tincture is starting to get into the bloodstream. And as that tincture is wearing off, you can utilize a gummy. Gummies take about 30 to 2 hours to get into the bloodstream. So you're always layering these products so that person who has Parkinson's has a steady state of CBD in their bloodstream at all times. So yes, the Power Gummy, I absolutely would recommend that they have a gummy about 30 minutes or an hour before it's their time to go to bed. Start low, go slow. You can start with a half a gummy initially, and then if you see that they're waking up in the middle of the night, they're still irritable, they're still having some discomfort, then increase that gummy to 1. You absolutely can use the gummy midday. Midday is a lot of times when Parkinson patients get a little bit more irritable, they're having a little bit more discomfort. So you can utilize that Power Gummy twice a day. So just to recap, we're assisting with symptoms of tremor, symptoms of anxiety, a lot of the mental issues that those who have Parkinson's, insomnia, dystonia, joint pain. A lot of these symptoms absolutely can be reduced with our CBD products here at Wakana. Our products are tested, they're third-party validated, they have certificates of analysis, and these products work. So I'm going to end my presentation here. If there's any questions, I'm going to allow you to put your questions in the chat box. Robin, if you want to unmute your mic and come off of video, if you want to chime in, you can as well. And you can put your questions right in the chat. Any questions? Anyone out there have someone that they know with Parkinson's or a family member that has someone with Parkinson's? It is the 14th leading cause of death in the US. And right now over 500,000 people have Parkinson's in the US. So it's not something that's rare. It's pretty common. No questions? You guys are awfully quiet tonight. Are you out there? I know you're out there. Robert, Lorraine, Lauren, Elizabeth, Ann, Diana, Carolyn, Brenda, Tammy from Boston. Anyone have any questions, any comments?
Hi, Dr. Rita.
How are you?
Fine. I've seen lots of people with Parkinson's. I actually have an aunt in Virginia who has Parkinson's. She's like 93 or 4. Her brain is functioning very well, but she does have discomfort, I know. And I have not offered her these products before, but now that I hear you, I think it's a great idea.
Absolutely.
Yeah. And then I'm starting to notice a slight tremor in a friend, especially the head bobs a bit. And is it time to offer some of this to her?
Absolutely, yes. It is time to offer some of that to her as well.
Okay. All right.
Right? And you also want to, you know, when you have people that are that close to you, you want to offer them lifestyle modifications too. You know, talk to her about her diet, talk to her about detoxing, talk to her about, you know, eliminating alcohol if she drinks alcohol or any other toxic chemicals, smoking, nicotine. Um, Ensuring that it's a holistic approach along with the products that we talked about tonight.
Okay. That sounds like a deal.
Yes.
Good idea. Thank you.
So we do have a question. Lorraine Dickerson asked, Dr. Rita, what do you suggest for allergies? So for allergies, I highly recommend our black seed is one of our essential oils. I recommend our nasal defense. Our nasal defense is a CBD nasal spray with essential oils as well. It works amazing for allergies, for sinus infections, as well as it works very well to reduce the viral load and bacterial load that we see during this season. I also recommend for allergies that you remove dairy from your diet. No cheese, no milk, no yogurt. All of those foods produce a lot of mucus and worsening allergies. So my recommendation, Lorraine, is black seed oil, our first defense, our nasal spray, and removing dairy from your diet. And those things will absolutely change your life. They change the life of my son. If you're not already on our tincture, the tincture will be the drops that you put under your tongue. That's also something that I put my son on to maintain that reduction in inflammation in the body. My son now can go out and play golf when the pollen is everywhere and not have any issues. So I added one more product on. That's our Hempranium 500 tincture, our nasal first defense, as well as our black seed. Those are really great products for allergies and absolutely removing all dairy out of your diet. Any other questions?
There's a question in the Q&A about arthritis for the knees.
Oh, wonderful. Kim Radford. Yes. So arthritis for the knees is absolutely something that is here. If you can see the slide, arthritis, you want to get our Extreme Power Pain Cream and or the Liquid Relief. Those are two topical CBD products you're going to put in those sore areas of joint pain and inflammation. You definitely, for arthritis, want to utilize our tincture. You can utilize our Hemp MD or our Hempranium 500 milligram, 3 drops under the tongue twice a day. And then at night, you want to use our Power Gummy, either a half to 1 whole gummy. That also will help reduce inflammation and pain so you can sleep well. You can get a good night restorative sleep. So those are the products, yes, I would recommend for arthritis. Thank you so much, Elizabeth Ann.
My pleasure.
What is HHC, THCO, and Delta 10? Those are other cannabinoids that are new cannabinoids on the block. There's lots and lots of cannabinoids. In fact, there are a lot of research where they're utilizing like a Delta 10 or a Delta 8, or they're using just specifically a CBN to really address therapeutic modalities for a lot of different diseases. So those are just other cannabinoids that work in conjunction with CBD, and they work solo to CBD to help specifically with different areas in research in the body. Like CBG is being used a lot for GI discomfort and glaucoma. CBN, they're using a lot. They're looking for CBN and helping to reduce seizure disorder. So a lot of those new cannabinoids are still being researched and looked at. There is a lot of technology in extracting them from the plant, and that's not easy. So until they perfect that, we will, not be offering those at Wakana because they are so new. So hopefully I answered your question. Those are just other new cannabinoids on the block that are being researched right now and seeing where they're utilized best for medicinal benefits. My customer tried the gummies for sleep for 2 months. He asked for something else. What is your suggestion? So Brenda Jones, if your customer needs better sleep, you want to recommend that you put them on the tincture twice a day, as well as the gummies. I never ever recommend one product. Never, ever. You always want to layer the products. You want a steady state of CBD in their system. And once those receptors are fed, once the body is put back in balance, you can start reducing some of the amount of CBD. But if someone has an issue with sleep, they have insomnia, you don't want to just recommend the gummies. You want to put them on a twice a day tincture. You want to put them on the gummy at night. And another thing I found that's very helpful is the Extreme Power Pain Cream, because at night we have those trigger points, right? We've got those trigger points where our muscles are tight, our muscles are stiff. So I take the Extreme Power Cream and put them on my trigger points, the back of the neck, my lower back, the areas that are sore from working out, my knees. So I would recommend adding those two products along with the gummies, the tincture and the Power Extreme Pain Cream, just having them rub his body down at night so that you can really relax and get some restorative sleep. Bipolar disease, the same thing, disorder, bipolar disorder. Again, the neurotransmitters in the brain can be fed by CBD. Lots of studies have been shown that CBD can reduce some of the symptoms of mental wellness, not mental illness, but mental wellness. So utilizing the tincture, utilizing the gummies would be a great start for those that bipolar can be mania and it can be depression. That's why they call it bipolar. It's got two parts. So yes, the CBD will come in and improve the mood. CBD will help them sleep. CBD won't cure bipolar. CBD won't cure arthritis. CBD won't cure Parkinson's, but CBD can assist with the symptoms. So you absolutely want to be very intentional when your customers, your friends, your families are asking about your products. Make sure that you don't give them the impression that CBD is going to cure anything, but it's going to improve their symptoms. Okay, thank you, Dr. Rita. A local smoke shop has those new ones in their stores. I was offering a possibility of the store owner buying our product in bulk and put them in stores. So great question. So smoke shops are very hard to sell bulk to, because smoke shops buy really cheap products they buy products that are not the quality that we have at Wakana. So smoke shops, gas stations are very hard sales in our bulk order forms, our bulk orders, because they're not looking at quality, they're looking at quantity. So good luck with that. I'm not trying to discourage you, but smoke shops are looking for a totally different quality of product than the products we have here at Wakana. Wonderful. I'm going to check in the Q&A. Yes, CBD will assist with symptoms of multiple sclerosis. Multiple sclerosis has also issues that affect the brain and the motor center of the brain, like Parkinson's. It's a neurodegenerative as well as an autoimmune condition. So with multiple sclerosis, I would recommend the same exact product line here. I would recommend the Power Extreme Pain Cream. I would recommend the Liquid Relief Rollerball. I would recommend the Hemp MD as well as the Power Gummies. Now, if someone with multiple sclerosis has random drug screens, I would recommend our Pure Tincture and our Pure Gummies. The topicals won't pass through the blood-brain barrier. They can be used safely in those who have urine drug screens. But the only difference, if someone has multiple sclerosis and has urine drug screens, I would recommend our Pure products, which are our broad spectrum products that contain less than 0.0% of THC. Yes, for multiple sclerosis, CBD has been found to reduce muscle spasms, to help to improve sleep, improve the anxiety that comes along with multiple sclerosis as well. Any other questions? We've got about 5 minutes or so. Let me look again in the Q&A. For people who smoke THC on daily, who could we offer them CBD? What could we offer them CBD? Yeah, so people who love to indulge in THC, absolutely, I would recommend our Delta 8. Our Delta 8 products are very close cousins to Delta 9. So the Delta 8 gummies I would recommend. I would recommend the Delta 8 smokable, our vape cartridges. I would recommend the Delta 8 pre-rolls, and then very soon we'll have our Delta 8 water soluble on the website. So those who love to indulge in THC love our Delta 8 products. Love, love, love. That is a for sure sale that will happen for you. So if you are a guest on the line, I want to recommend that you connect with the person that invited you so you can get your products ordered. You can get more information from the person that invited you, other information that we may not have talked about, because tonight was concentrating on Parkinson's, but just know we have a lot of amazing products that will assist with many symptoms. I'm going to put my email address here. It's ritamd@wakana.com. If you have any further questions, you can email me here. Otherwise, connect with the person that invited you so that you can get your products ordered, you can get your questions answered. And I want to thank our medical advisory board member, Robin Tillman. She is a registered nurse. I want to thank my other colleagues and business partners, Elizabeth Ann and Tammy from Boston. And I want to thank you. I want to thank our guests and other business partners that have joined the line this evening. Thank you again. We'll see you next Wednesday at 8 p.m. Be well, be safe, and God bless you all.